So during this video, we're going to talk about coughing techniques. But first, I forgot to mention during the breathing techniques video that there is such a thing called the tripod position. You may see this as patients kind of bracing themselves, or athletes, you know, they're breathing heavy, they brace themselves on their knees to try to use accessory muscles to breathe. You can do this in that standing position on your knees. You can do it against a counter or a table, or you can even do it in sitting, okay? So that's just one way that you can kind of advise your patients to kind of help them get a better breath in. You can also educate them on some of the other techniques we talked about, breathing in through your nose, using your diaphragm, breathing out through pursed lips. You can do paced breathing, all that kind of stuff, just with the tripod position. Okay, so on to coughing. So normal coughing is, you get a deep breath in to prepare, kind of have a pause at the top, close your epiglottis, and you force that air out against the closed epiglottis. Okay, so a lot of patients have trouble with that, breathing in and the breathing out. So what we can do is a lot of different things, both self-assist and therapist-assisted techniques, okay? So one thing you can do is called huff coughing. It's not as forceful. You don't have a closed epiglottis. Your epiglottis is open, but if you do it enough, you can actually get a kind of a productive movement of fluid, okay, and mucus and everything. So what you can do to practice this huff coughing, it's similar, it's the same thing that you would do if you were cleaning your glasses or steaming up a window to draw on it, as your mother probably hated that you did. But what you can do to practice is use like a tissue or something, or some glasses or something. But if you use a tissue, you can see it move and you know you're doing it, okay? So kind of go sideways here so you can see. So, okay, so it's huff, huff, okay? Another thing you can do is just flexing at the, at the waist, flexing forward, kind of using your abdominals to force that air out, okay? So, just like that, okay? And then some people, they may have an incision, or perhaps they have a fractured rib or something, and it's really painful to cough, so they don't have a productive cough. One thing that you can kind of help alleviate that pain by is just called splinting. So having them put their hands over the incision or the fractured rib or something and have them cough with that. If that's not enough, you can use a pillow, okay? So you can kind of hug the pillow and have them cough like that, okay? So, like so, okay? You can also do what's called breath stacking. That's another way that I guess I didn't really mention in the breathing techniques, is you literally are stacking your breaths before you exhale. So it helps you get a deep inhalation, okay? So breathing in, pause, breathe in a little bit more, and a little bit more. Okay, so if you have trouble getting your air in to force enough air out to get a productive cough, maybe breath stacking could be what you can use, okay? So now we're gonna do some assisted techniques, okay? So again, we have Salam the sloth here to help us, okay? And what we're gonna do is we're gonna, again, have him in supine. We're gonna have him on his back. And what we're gonna do, it's called the costophrenic assist. So we're gonna have him breathe normally, and I guess, again, hands on the lower costal region here, just like we did before, but now we're gonna instruct him to turn his head away from us, okay? So if he could, he would. And we're gonna have him breathe in normally, but turn his head away and then cough. And when he coughs, we're gonna push in and down, okay? So breathing in, go ahead and cough for me, and down, okay? It's not a super forceful movement, it's just facilitating that exhalation, okay? Another way you can do this is called the Heimlich assist, okay? So this one's gonna be in and up, kind of like the Heimlich, okay? So we're gonna have him breathe in, turn his head away, and cough. There we go, good. And he can do this himself, okay? He can have his hands there, breathing in, and coughing, okay? Same for the claustrophrenic approach, okay? So once they get good at it and you feel they're, they're able to reproduce those same movements, that can be another home exercise to help them, okay? You can also do these sideline, okay? So we're gonna have him laying on his side, okay? So we do the same thing. So claustrophrenic, breathing in, he's already turned away from me, and breathe out, and breathe in, and now you're gonna cough for me, okay? Down, okay, in, so down and in to kind of help him cough, okay? And then same for the Heimlich, okay? We're gonna have our hand here, breathing in and cough, down and up, okay? And then there's a way that you can kind of combine these. It's a little complicated, but I believe you just do them at the same time, okay? So kind of to encourage that coughing even more. So breathing in and out, coughing, okay, like that. Another way that you can do this is with counter rotation. So we're gonna have his arm back. So we're gonna have a breathe in, open up. So remember we did our diagonals, breathing in, we're opening up to get a good breath in. And then as he coughs, I'm gonna throw his shoulder and arm forward, okay? So breathing in, good, and cough. Okay, like so. Let's see. And you can also do the same thing again in prone, like we did before, okay? I'm gonna try it without the pillow this time and see how it does. So we're gonna do the same thing where he breathes in, propping on his elbows, and breathe out as he goes down, okay? So breathing in, it's that flexing, movement to force that air out, similarly to our breathing techniques, okay? Don't mind the dryer in the background, buzzing. Okay, and then another thing you can do, so we're done in prone, is in long sitting. So you can have tetra long sitting, where their hands are propped behind them, okay? And we're gonna breathe in, head back, good. And then again, it's gonna be forceful, okay? They're gonna do this on their own, okay? It's him, but me. He's gonna cough and throw himself forward over his legs, okay? You may have to work on hamstring length with these patients before getting to this point, don't forget your musculoskeletal stuff, okay? So breathing in, propped on his arms back, and forceful out, like so. You can also do, para long sitting with his hands behind his head, okay, like so, okay? And he's going to breathe in again, his head back, and forceful out, like so, okay? And then you can also have him in short sitting, okay? Same thing, breathing in, breathing out, okay, with the cough, okay? And then last one, might be difficult to demonstrate on him, I'll do it for him and then I'll show you, okay? So breathing in and cough, like that. So I'll show you again on myself. So breathing in and coughing. Breathing in Okay, so that rotation, similarly to when we did our PNF diagonals, coughing with the rotation. Okay, so I hope this video has been helpful. Sure was helpful for Salam the sloth here. So we're going to continue to work on some things, and I hope you enjoyed this video.